All right. So thank you, Tahis, for doing this. I appreciate you taking time aside to come on to the Mahogany Honey podcast. Yes, because we're in the process of rebranding. And so you're like coming on as one of my, my revisiting guests. I had you before. Now we're on here again. And I'm so happy to catch up with you because of everything that's been going on in regards to COVID and just like how we're trying to cope, and you being, working in the professional field of mental health and just like giving us some insight as to what that looks like now, right? So with further ado, we got Tahis Zuniga here. Today's purpose and our topic is basically mental health awareness. You know, Thais, you and I, we go way back from working in the social work field, and just like now you being full blown and working in a setting where it's just very interesting in navigating that. So feel free to give the listeners a little insight as to that and like your background.
Okay, so I have a master's degree in social work. I worked in the child welfare for a little while, and then from there, I went ahead and transitioned into the mental health hospital. So that's where I'm currently at right now, at one of the mental health hospitals here in South Florida. And I've been working there for the past almost 3 years already. So in the last 2 years, I've been working more with the geriatric population. So that's what I've been dealing with currently. So
Yeah, so you see a lot. You have inpatient, you said?
yes, the
You are.
geriatric inpatient, and I work all the units. So I worked with children, I work with adults, I work with the geriatric. I've had patients that have been in corrections. So, I mean, anything and everything that you could think of with the mental health or social issues, I've seen and I've dealt with.
So give us an insight as to what shifted and what you've been adjusting since the pandemic.
So since the pandemic, which started, I believe, in March, like the second or third week in March, we supposedly psych we weren't going to see patients with COVID because, of course, COVID is more of a medical issue than a mental health. So we didn't have to worry about it. That's what we were told, that, we were just blowing things out of proportion. We weren't going to be exposed and we didn't have to worry about it. That's what we were told. And that if a patient did come in with COVID, positive for COVID, they will immediately be transitioned into the medical side, which we did. And that did not happen. The unit I work with is the geriatric population. So as we know, in the mental health hospital where I work at, the first positive patient was in my unit. And then after that, half of the unit, which is like 20 patients in that unit, half of that unit got exposed to the COVID virus. And then some employees as well got exposed to it. And it just triggers down to whoever received the guidelines of how they were going to manage the test, because that they weren't testing patients that were coming into the mental health facilities.
Oh, wow.
Because they said, oh no, it's not, it's going to be everyone is going to go into the mental health, we're not going to worry about it with something that we shouldn't even consider it. Their medical is already doing their own type of thing. And of course, if someone doesn't feel the symptoms, they're going to go into medical. They're not going to go into mental health, which is
how did you feel about that personally?
I felt like I didn't have a voice. Like I couldn't advocate for myself. I couldn't advocate for my colleagues. I couldn't advocate for my patients, because I do work with elderlies, and they're very vulnerable. A lot of these patients have dementia, Alzheimer's, and a lot of other medical issues. And I felt like, you know, like my voice was not heard and I couldn't do much but just sit there, and it's basically it was just a waiting game. And that's exactly what happened in
When
this.
you refer to waiting game, because I know earlier we were kind of just like getting into, you know, some of the keywords being like burnout and just like productivity and like just as millennials, us trying to navigate, like we're tired, right? We're exhausted. And I just recall from our conversation earlier, you mentioning how you guys have a union.
Oh yeah.
So
We did reach out to the union. My position is a unionized position. So all social work positions are unionized. I believe nurses are unionized. Techs, there's all type of unions. So like if there's something going on and you feel like your administration it's not listening to you and you need someone to advocate on your behalf to find a middle ground, of course you go ahead and you speak to your superiors, and then if they don't feel like that's been resolved, then you go to your union. And a lot of my colleagues did it, you know, and I supported it because we do work in the same field and I had the same interests. I'm not gonna lie about it. And nothing was done. I mean, we got the mask. They didn't want to give us mask at first. We got the mask, then we got the hand sanitizer, then we got our hand sanitizers, which is like the pocket size one, ran out like within 2 weeks. So when we wanted to get a new one, that was like another hassle. And then, you know, it was like a day by day learning experience with the whole thing. Like your emotions were either really high or really low. It was a constant battle with like ethically with yourself and what was going on in there. And I think a lot of us went through it emotionally. Like at the beginning, all of us were very supportive with each other. We tried to like work with one another as colleagues and like be the support system and check on each other because, you know, a lot of things were changing. But then it's like at the end, we got into it because all of us were burned out. Everyone in there is burned out. No one, the doctors are burned out. The nurses are burned out, you know, and it's not like you could have asked for help and your voice was going to be heard, you know. And then a lot of the guidelines change constantly. That's another thing. The guidelines were changing constantly, or they weren't updated on time, or, you know, guidelines only pertain to the medical side and not to the psychiatric side because they didn't know what they were going to do with the patients in psychiatry. It's been a very interesting, I guess, event.
experience.
Yeah, experience, event to be part of. I could say, I
Oh,
mean, there's a lot.
well, I
Just
know,
try to keep it concise.
yeah, I know from speaking with you even prior. I remember like initially when I was living over there in Miami, and I would sit down with you and have conversations like working in a hospital setting. That's the culture. It's nonstop. It's 24/7, and that jumping into the social work field, that it would be somewhat different. However, is probably the same animal, somewhat the same animal.
Yeah. I actually, in this whole transition, I've made friends with the social workers out in medical, and there's one particular social worker which I like love because I like reading her notes. She's very detailed. She's like a very old school social worker, and she knows exactly like what goes on with her patients that are assigned to her. So I touch bases a lot with her, and she's burned out too, and she's been working through the whole entire pandemic. The same thing, experienced the same thing that I've experienced: burned out, emotional roller coaster. She gets there at 8 in the morning, and it's probably like about 5:45, and she's still there. And we call each other because sometimes we have the same patient, or my patient is going to her side, and a patient of hers is coming to my side. And I think everyone is experiencing the same thing
Yeah, and then
in the medical field.
when that does happen in being in human services, we also talked about how the morale starts going down, right?
Yeah, your morale goes down, of course, because you are human. You're not like a wall with no feelings, no emotion. I mean, nobody goes into this field just to make money. You go into this field because you want to make a difference, because you want to genuinely help someone. You want to go ahead and advocate on someone's behalf. You want to create a better system for individuals that are vulnerable. And in a situation like this, your morale was constantly, I mean, my morale was constantly on the floor, like most of the time, like I feel better. I'm not gonna lie to you, I feel better now in this month of November. I finally like was able to like pick myself up, because I was like really,
I
like I
remember.
didn't even know what was going on with me at all.
Wow.
At all. I thought I was, I was still working out. Like I will go and work out. That's what I managed to do. I will still like talk to people. I will still like, try to wake up early, do my meditation, my prayer, like had my little routine until like I couldn't anymore. I asked one of my close colleagues, it wasn't normal. And then she's like, well, you're probably just stressed out. Okay, cool. I'm stressed out. And then it wasn't until like I decided to book like a last minute session with my life coach. I I told her what I was experiencing. I told her how I was feeling, and then she started asking me questions, and everything had to relate with work. And then I told her that I was basically like afraid to end up like numb, like no feelings, like, not caring about anything or anyone, even myself, because what happens when you burn out? You stop caring about everything,
Yeah.
like some certain people, they burn out and they know how to like keep it moving. Or other people's, what happens is like they stay in the same situation, they're burnout, but they have relationship issues and at work, family members, lovers, with friends, and they end up alone. And then those is like you end up alone, then you cause your end up with depression or anxiety. And there's a bunch of other factors that could happen to you, health wise, physical wise. So it's like I broke down and I told her exactly how I felt. And then she goes, you are stressed out. Like your body is stressed. You couldn't handle it anymore. She goes, by the grace of God, basically, like something magnificent, you did not have a mental breakdown
Breakdown. Yeah.
earlier, because maybe God had been protecting you and something, you were able to keep it together this long. But a little bit more, you would have had you would have had a mental breakdown, because it was literally like at the end, my body was aching, like when you're sore of working out. I even stopped working out because I thought I was working out too much, that my body was aching.
Yeah.
So that's how I felt, like my body was aching. Like I would like type and I couldn't see, like everything in front of me, I couldn't see, like everything was just a
Oh my
blur.
god, you're gonna make me cry.
It
I was so,
was
because
bad.
I no, and I know what you mean, because I felt like that at some point, and I can only imagine feeling like that without the pandemic, and on top, having the pandemic on top of that. Like
Yeah,
I'm just like, I'm
yeah.
feeling for you guys. Like I'm trying to do the best I can to like show support. I'm like
I'm
by doing this
appreciative.
for
Yeah,
this.
you do. And you check up
By
on us.
having this platform, but it never feels like enough though, and it breaks my heart. It really does, genuinely breaks my
Yeah.
heart. But
Yeah. And the sad thing is that even though we're professionals, we do not seek our own help, guide, because it's America, I guess, and then
Yeah.
professionals do not seek other professionals sometimes,
You're
and
talking about, yeah.
here's you deal with it, you face it, and you keep going, and there's nothing else to keep looking back for. Why are you looking into your emotions? You cannot show emotions because we're not supposed to show emotions where we're trying to help other people with their emotions, and we're trying to be advocates for other people that can be advocate for themselves or speak up for themselves. So and it's been hard because I just like you are, I'm very strong-willed, very strong-minded, I'm very independent. I don't like depending on other people, which is it's a good thing and it's a bad thing. Thankfully, like I've been able to keep up with this life coach, which I freaking, I don't know what I would have done with myself if I would have not met her. She sincerely has helped me genuinely, and she we work together perfectly well. And the support system as friends that I have been great because I can tell you I can rely on my mother or my brother because they don't know, like, what we go through, like what we see or like how we feel. I mean, they show support, but it's like I've told my mom and she's like, oh well, why don't you just change your work,
Yeah.
or why don't you just look for something else? I like I I never told you to go into that field. I'm like, I know you never did, but I mean, something that I genuinely always like doing, like genuinely helping and facing challenges. It's been a whole like turmoil of emotions, and facing yourself and like how you could do better for you. So that's what I've been dealing, and then now I'm back to like trying to do some type of normalcy for myself. I've taken it easy. I do as much as I can. I work at a certain pace. I don't try to take things personal. It is hard because I work with elderlies, and I do care for them. I do really care for the elderlies. It's a
Yeah.
population I never wanted to work with. Because I love working with kids and I specialize in child welfare, and that's what I wanted to do. I wanted to be a play therapist, but things happened and I didn't get there. And like working in mental health, I would have told you no. But it's like a goal in life that I had that I never thought that I could get to.
Okay.
Because it's
Yeah.
where I work at. It's tough.
Yeah.
It's not easy. It's constant on freaking 100 all day. The population you serve is not the most easiest population, and the setting is not the most lovely setting. It's not.
Oh man.
And but everybody wants to work for this, I guess, branch area. I don't know, like this hospital. And I would have changed it. I don't think I would change now that I'm not now. I don't think I would change my experience working with them because I've been exposed to anything and everything. I've learned so much in the last 3 years. Been exposed to so much,
So you've gained
and
skills and experience.
I
Yeah.
gained a lot of skills, a lot of experience. I've done a lot of networking. I've built relationships with the outside community. I think I've even gathered information for my superiors and my colleagues for them to use, because we use a lot of the outside resources, and for
Hmm.
some reason we didn't have that relationship. And because of this pandemic and the way it has been, the system has worked, like the way the roles are at right now, which people are
Hmm.
working from home, so the only way of communicating best, it has been either via Zoom or via email, and that's helped us build a better relationship, which is, it's good for us, and it's good for our patients.
Yeah, I wanted to touch base too on how is it that we stay trying not to get to that point of burnout. It's okay to get to a place where you're like, you know what, I think I need help, like asking for assistance. And you mentioned your life coach.
Mm-hmm.
And I remember like originally before, when I used to live in Florida and I was heavy on in the social work field and being in a very pressured focused like environment, working in the courts and just like being on the field at times too, or just being in the office and kind of balancing everything. I got to the point where I was like, okay, I think I need to talk to someone, because I was hitting that numb point that you were saying. Like, I feel like I'm not caring anymore. It's just too much. Like I'm losing myself in this. And the struggle behind that was, when you're a social worker, either you know the social workers that you're working with, that like for you to find a therapist, for example, let's say we work with therapists, so it's like, how do you do that confidentiality and trying to seek assistance as a person who is in the social work field? And also, if not, you probably went to school with them. So like those things that you come across, and help me bring up any other barriers that may have you like resisting from
Definitely,
seeking
I'm not
assistance.
gonna lie. I did look into my list of resources with my insurance and see who were the therapists that were affiliated. And as soon as I saw social work and clinical social workers, and I was like, some of the names look familiar. I probably worked with them on a case. I've probably seen them in school. I probably went to school with them. So I'm not gonna lie, I did not go with that list. I didn't. And then I actually tried to look for psychologists, and it's, I don't know, maybe there's not much psychologists as there used to be before when we were kids, but now I see there's more clinical social workers than psychologists. I don't.
Right. And then the other catch is like paying for a therapist. Like,
Yeah,
we don't even get paid enough to afford
you don't.
to get
So
help.
yeah,
Like,
definitely. So my job does have, I think they call it something help, like employee help
yeah,
resource.
some jobs do have that
So
benefit.
they do have it. I checked it out, but I believe there was like a waiting period and you have to go like different steps. And I'm like, I know, I'm like, no, I'm like at the breaking point that I really need to see someone. And I met my life coach through someone else that I work with, sending like referrals. I'm like, I'm just gonna try it out. That was last year, so I'm gonna go ahead and try it out. I'm gonna have nothing to lose. I mean, shit, I still have to pay. Sorry, still have
No,
to
you're
pay.
fine.
With my insurance, I still had to pay out of pocket. You know, like there was one. I think she was no. Oh yes, she was a psychiatrist, an ARMP psychiatrist, I believe, and loved her work, and her background and how thorough she does her assessment to her patients. And I wanted to see her, and she's in the South Miami area, but like the first session was like $350, and
Yes.
I was like $350. I'm like,
Right. I was like, I'm in the wrong field.
I'm like,
Can I tell you that I wanted someone on a doctorate's level, because working with so many like in that field, you kind of know the quality of work that they provide at times. And now it's another factor too. So just like you, I wanted a person of color, because I was like, I need someone who can relate to some of the things that I've gone through, or that I go through, or whatever, and is familiar with them on a personal level. So I wanted that. Even though not all people of color have the same experiences, let me put that out there, because I know there's always going to be a person that's going to be like, no, all experiences are the same for everybody. And I'm like, yes, I know that. So then I wanted a person,
you're
and
able to relate more.
yeah, and then I wanted someone who was on a doctorate's level, right? Who like had the PhD. So looking for that, I found a lack of, I don't know now, but I want to say like a year or two ago, there was a lack of
African Americans.
Yes, African Americans or even Latinas, Afro Latinas with on that level.
Yeah. Maybe it's more like
and Miami-Dade. Let me specify,
like a
because they might
Miami-Dade.
be in New York. You might find one in New York or somewhere
Yeah.
else, but
Maybe it's more like a Miami-Dade thing, but maybe like in Broward there is.
so
There's Hispanic Latinas clinical social workers. Actually, there was more clinical social worker because I did a general search of therapists in my area, and I saw some therapists that there were 2 or 3 were my professors.
Oh my god! Like, see, you see, it's like.
It's okay to some people, but to other people probably not. Like myself, I don't think I've ever built such a close relationship with a professor in my undergrad or grad. Probably, I actually in my grad, yes, I did. Professor I think her name was Professor Gray, which I loved her. And she has a PhD in social work, and she did write a lot of articles. And if she would have been like an option to do therapy with, that would have been a professor I would have opened up to more, because there was like a project that I did with her in her classroom. You see yourself, and I wrote it, and she actually gave me a great feedback, and she wanted to speak to me more about it actually, but I was not ready to face her questions in a way. And I was flattered, but I was also like a little like embarrassed, I guess. Shy, not embarrassed. I was shy, not embarrassed. I was shy because I just didn't know like what was her question, or like what was going to be her intentions, and like how do I open myself up to someone like that, you know? She had the patience, and she knew every theory, and she's had used every tool in therapy, cognitive therapy, narrative therapy. She's written articles and books about it. But that's the only professor like I would have opened up to compared to everyone.
Yeah, and then the other big thing about taking that step is you prioritizing it, because it makes no sense if you're seek the help, but then you don't keep up with it, and it's like contributing again to your burnout process.
Yeah, like if you don't like if there's tools and skills that they teach you, and if you don't do it, then what's the point? I mean, we more or less I feel like we know because we have that background, but a lot of people, they don't use it, you know. And then it's something so simple like journaling your feelings, reflecting back to it. How did you feel when that person said a certain thing, or like doing a setback of like what happens when you feel triggered or you feel a certain way, you know. I believe now that I am like more in tune with myself and a little bit more mature, I will say.
I will say I do notice a difference. I will say that. I do.
So I think it takes a lot for a person to sit there and want to learn about themselves and be okay of knowing that they're not perfect, and that there's things that you have to change. I've always been open to change, and I've always wanted to change. I've never been shut to it. What was it that I needed to change? I never like exactly knew.
Right.
But I've always taken steps towards change.
Yeah, and there's levels. Like once you open one door, like there's 20 more.
Yeah. Change is what do they say? Change is inevitable.
Yeah.
And everything is step by step. It's day by day, and you know you can't compare to yourself to your friend or to your lover or to your best friend or your colleague, because everybody's on their own different journey.
Absolutely. And now, do you have a different position with the pandemic? Like, you know how they talk about, oh, thank you to the nurses, thank you to like the teachers, and thank you or to this person or whatever.
Yeah.
And at times, I feel like we all have our own front line. You know, I feel like everybody is on the front line in a different level. They're like from a different angle. So we're all battling. So what skills do you feel like you have attained from the pandemic, like this year?
Damn, that's a good question. I've learned so much. I can't even tell you. Okay, so like one of the things I think I've gotten better at, which it's networking. I that's something I've always never saw it as that, but now that it's a skill. You know, not everyone has that skill, how to network, how to talk to others, how to build that relationship. Because like, okay, so I'm gonna go ahead and talk to you about one of my cases. I've had a lot of VA elderlies lately, that they've they've been at a skilled nursing facility, and whatever, for A and B and C reasons, the skilled nursing facility goes ahead and sends them out to our psychiatric facility, because they need to be I need a psychiatric evaluation, and and they need medication management. So like, it's like, wait, you're a VA recipient, you have active benefits, you know, like, who do I contact at the VA? And I built this relationship with one lady that the VA has. Is her title is, believe, is nursing placement community coordinator, something like that. And with her, she was able to refer me all the nursing homes that are affiliated with the VA that a VA recipient could go to, and they will cover 100% if the VA recipient has 100% benefits, right? That's something I learned, which I didn't know. Another thing was, I had a 93-year-old, because now I have a 96-year-old. So I had a 93-year-old, the poor guy. I felt so bad. I almost cried in front of him. I literally did. He had been living in his car for like 2 months, and he's a veteran. I called the same VA lady. I asked her, listen, this guy is a VA recipient. I cannot, like, we cannot have him in the street. Like, we need to do something. He's a 93-year-old that tells that he could knows his name, date of birth, his address, what he did when he was born, like, able to eat on his own, walk, shower on his own, very sturdy 93-year-old. He's probably like my height. Yes, he's my height. I'm like, I can't have him in the street. Like, we need to do something for him. So with her, she referred me to a community outreach VA social worker. Then the community outreach social worker, they work with another program that is out in the community that places VA recipients. So it was like a whole team, and it was like, I dropped everything for every other patient because I don't have anybody else helping me in my unit. So I dropped everything to help this patient get him back situated into a home. And then it was interesting. And then that's how I built a relationship with the nursing coordinator for the VA and the outreach coordinator for the VA, and also for the, I believe it's called low income housing for VA. So, and they're all social workers. They're all clinical social workers.
Oh, wow.
So it was like interesting to like build this relationship with them, because before it was really hard to get them. Before the pandemic, it was like, you will call this number and leave a message, and you will hope they will call you within 24 hours, because they're busy. They're busy too.
Yeah.
But because of the whole pandemic, they're on rotation and they work from home, and they have to rely on their email. So they're very active on their email. They answer back within 24 hours. They'll give you a call and give you information. So that was like one of the networks I mean, built. And then I built another one with Miami-Dade County low-income housing program and the assisted living facilities. So that was like great because it's really hard to get these people, really hard.
So look at you.
Yeah, that's what like excited me about this whole pandemic, like building relationship via email.
Hey, somebody's gonna do it, and you obviously nailed it down. So
Yeah.
you're
The
the
queen of emails, yes, that is me. DCF loves me. The Department of Children and Family loves me.
And what do you think has taken a back seat now?
With me or like at work?
At work, or you could even say personally too, due to just
Uh,
like
Due to like the situation that's going on, I believe my whole entire like social life, if you know me, you like know that I love socializing and talking and like yo like happy hour, where are we meeting?
yes.
That's definitely me, but because of because of this going on, and that's not priority anymore.
Like, do you feel a responsibility? They carry a responsibility now when you're out and about because of the setting that you work in?
Definitely, yeah, I do. I try to be as responsible as I can because I believe that let's say if I do get the virus, knock on wood, I don't want it. I don't want to get it. But like I wouldn't want my colleagues or my patients to get it. So I try to do my best to, you know, not go out in big social gatherings, or and if I do go out somewhere, I do wear my mask. If I do go work out, I wear my mask. Like, have you seen so much my most of my workouts? I am wearing my mask. I do carry my hand sanitizer. I do wash my hands before and after places. I shower as soon as I'm like coming from a place. I change clothing, shower. Like I've kept the same routine that I've done since like the beginning of this whole pandemic, which is try to be as careful and hygienic as possible. And my vitamins.
Yeah, yeah. But how we were talking before, like hopefully there we find a balance, right? Because now I'm gonna lead into like, what work home balance, like what does this look like now? Like what does it look like?
Yeah, like so some people were blessed to be at home and work from home, and some enjoyed it and some didn't. I did not get that luxury to choose to work from home. I worked throughout the whole entire pandemic. I showed up to the hospital. I worked weekends. I wore my N95 mask. At times I still wear it. I still wear my mask. I wear another mask on top of it. I wear my goggles. It's interesting, but at the beginning, I mean, it gets tiring because it's us as human beings. We're not like used to wearing a mask. Uh, some people wear it 12 hours a day. Other wear 10, 8. It's hard. But that's basically I've worked the entire pandemic in person.
Wow.
With
I know, cause I had asked you, I'm like, are you working remotely or are you working in person or are you doing hybrid? You're like, no, I'm in person. I was like, oh,
Yeah,
okay.
I think in the hospital I work in, everyone that had to do with inpatient, getting care for inpatient had to be in person. Plus we're a 24-hour, 7 days a week hospital, and it's crisis intervention all day, every day. That's what we cater to.
I got you. So my experience with the pandemic, right? We were talking about like how we had these goals in 2020 or whatever, and how I had come back home, and I thought 2018 and 2019 was gonna take me out, and then 2020 came and I was like, oh, a fresh start. I'm in a new state. It's a fresh slate. Like, I
Yeah,
got
definitely fresh slate for everyone.
I ended up, so my journey of like I had to move back home, and like for me it was obviously it still is a temporary situation for me, but like having to like be here with my parents, it's been a bittersweet experience, bittersweet, and so adjusting to that and finally being able to find a job, like in March, and I was like, yes, this is like my way out, and I was like trying to navigate a new relationship, a new job, a new like environment again, readjusting. And then COVID comes and it's like, well, okay. So I was telling you my story how I relied a lot on public transportation. I had to like take the train to work because I worked in Boston. I worked in the city. And I predominantly worked in a city, in an area where COVID was actually the highest. That city had the highest numbers. Okay. So they gave us the opportunity to like work remotely at one point. So I was like, oh, wow, like my mom, everybody was like relieved. We're all like relieved. We're like, okay, like you don't have to expose yourself. You don't have to be like taking the train, like none of this stuff. Because taking the train in Boston, like it's almost like New York style. Like people are
In
like
your face.
yeah, like we're
Yeah.
almost on top of each other at some point. And like all of that. So I unfortunately I started setting some boundaries with my employer, and it came to the point where they let me go. And I was like, this is familiar. That's okay. Like, this is nothing new for me. But also going back to that burnout, talking about like that whole, like knowing your limits and knowing your own self boundaries, and like also not letting having already experienced burnout, like drastic burnout for me, where I completely was like numb and I had to seek therapy to that level. And then like already being in therapy, thankfully, that allowed me not to feel guilty
About
about
doing what you did.
doing what I did.
Mm-hmm.
And so going on this unemployment journey and whatnot. So like finding the balance between what's important in my life, reflecting on those things and like all that.
Yeah. Yeah, I also thought that 2019 was like the year I was like, okay, whatever I learned, uh, whatever I needed to learn then. I freaking went out, managed a social life, and still managed to like do a decent work. Um, and I was like, you know what, I'm ready to change. I'm like ready. I'm gonna go ahead and manage my life now. Like, let go of a relationship that I've been with for on and off for 12 years. It's time to like work on me and refocus on myself and like what is it exactly that I want. And I'm like, this is the new year. It's 2020. I'm gonna go ahead. Like the first month the second month of February, I already had like a trip that I went to, and I was like, yeah, fun. I'm like, shit, I'm ready to do another trip. Like that was gonna be it. Like my 2020 was like basically work on me more and travel and explore more and get more culture, but
Yeah, just like I wanted to move out. Now, being millennial, the millennial burnout, where we talked about
the
how we're
millennial
constantly going
burnout.
through change.
We've always
Yeah.
gone through change. I mean, I wish I could like have the time to like do a whole what's it called, a timeline, like everything that we've experienced. I think the millennials, we're a very interesting group of, we've always experienced the most things that we read in history books that we wouldn't think that we were going to experience,
Yeah,
what I mean?
yeah,
Like a
we
lot
went
of things
through,
that we've gone through, like it's like this happened like 40, 50, 60 years ago, 60 years ago, like we're going through it again, like come on.
yeah,
And it's like I feel like at this point we could write like a mini version, like a history of like what's going on like the last 15 years, um but but I think it's just made us more of a resilient group.
Generation.
Yeah, of generation. It's made us stronger. It's helped us build and made changes that need to be made. It's given us voices for ourselves and for those around. We've always wanted to work harder, smarter, and make a difference. um and I could tell you that from like every millennial that is around me, and most of my friends, like you know, my best friend, you know her, one of my good guy friends. We all of us have like the same type of interest. We all have different uh experience and work arena and background when it comes in cultural backgrounds, but like our refocus is always, all right, let's deal with it, let's find something better, and like let's face it and let's keep moving and keep going, you know. And I think it's a group of individuals that we face challenges and we face changes, and we're not afraid of change. We like
We're
change.
not. We do. We
We,
do.
we do. We do enjoy change. Because like every millennial I've met, like there's really close to me, and we talk about things, you know, like we always want something different. We're ready to go on and venture for something more. And then I'm probably like one of the youngest in my group at work. And the old elderly and the ones that have worked there for a very long time are very resilient to change. They're part of the generation, probably baby boomers.
Yeah, that's my mom.
Yeah. They're very resilient to change. They get really frustrated to learn something new. They hate making a different or going out of the norm or extra to make a difference, you
Yeah.
know. And I feel like, I don't know, maybe that it could be a cultural thing, but I believe that every millennial that I've met, we do take well with change. We like change, we challenge change, we face it, we endure, and we keep moving. We okay, cool, let's,
Yeah.
we don't like it, whatever, okay, whatever, but it has to be done, let's do it.
Right.
And I think that's the difference, and we work very hard to got into where we're at, and we find a way of like making things happen quickly,
Yeah. And
you know.
so my hope is that the generations before us can work with us right now, because it's make it less harder on us. No, jokes aside, I'm so serious, because I experienced that at work, where we had to go from being on site to having to, for me, take on and do virtual learning, like learn how I had to like teach myself first, because no one there, everyone there was older than me. So tenía yo que cogerlo y enseñarme yo misma. I had to like teach myself how to do something.
Mm-hmm.
And then on top of that, like take it on, heads on, and try to get everybody on the bandwagon. And everybody didn't want to get on the bandwagon. That's another thing.
I've never ever dealt with so many people that don't like it, or like they tried everything to avoid it. I'm like, but you've been working here 20 plus years, like, you know, there's change.
Right.
You were working here before there was email existed, so you had to learn how to use the email, you know, like why. So there's an individual at work that, I mean, I respect her very much. I respect everyone at work. But we went at it, and I was like, you know what? I'm like, no, I'm not gonna stay quiet, because her thing was she had to cover me one day. I had a doctor's appointment. I didn't want to miss my doctor's appointment because it takes forever to get your doctor's appointment. And I don't want to miss it.
Self-care, anyways.
It's never an easy day. But that specific day was very intense because I had So she calls me 4:30, and she goes, "Oh, you're not gonna give me a report?" I'm like, "Yeah, I'm gonna give you a report. Just waiting for you because I know that us you're in the units interviewing patients. So I didn't want to call you, so I was waiting until you told me that you were ready. So are you ready? Yeah, cool." So she comes to where I'm at. I'm gonna give her a report. And she goes, "You're not gonna write this down?" I'm like, "Yeah, I'm giving you verbal. You write whatever I tell you in your notes, your own handwriting, and then I'm gonna email you exactly what needs." Like brief. I really try to make it really brief.
Mm-hmm.
This lady turns around and she goes, because she had to do a couple of referrals or like follow up with referrals. She goes, "What do you think, that I'm your damn secretary?" And I was like, what?
Yeah, and then
I
and
was like,
that a lack of respect for
I was
younger.
like, "Your damn secretary?" I'm like, "Excuse me?" I'm like, "Wait, I don't know what's your issue, but I really don't have time for you today. You either want to cover me or you don't. I'm not asking you to cover me. I am following a directive from my superior that told me that you're going to cover for me. So, on that note, I'm going to call my superior, let her know what happened, and I'm going to let her know what you told me." So I did that. My superior told me, "I don't want you guys to be acting immature," which is right. This is a working setting. Both of you guys need to basically suck it up, and you need to give her a report, and she has to take the report. Call her, told her that, "Listen, I'm going to go ahead and write things down." I even started writing things down for her, everything, and I was going to rewrite it, whatever, right? By this time, girl, it's 5:20. She comes back. She says the same thing. She says that she doesn't know why she has to cover for me and all this stuff. Like, I'm telling her that she has to do. Mind you, she's only covering one day, 8 hours. That's all she had to do. And do the reports that she's been doing for the past 20 plus years. She called out the next day.
And this is why, ladies and gentlemen, it's important to seek seek help when you need it and know what the type of help that you need so you don't become miserable at your job 20, 25, 30 years later. Yeah.
Exactly.
That.
Exactly. Yeah. That's
That.
exactly what happens when you've been working for so long. You burn out, and you don't have, if you don't have a way to manage your own stress, you come in as a bitter,
Robot.
angry, yeah, and negative, what's it called, negative Nancy at work. And you don't want to work like that. You don't.
No. It's not an enjoyable experience for you, and it's not an enjoyable experience for other people. So like, man, seek the assistance that you need. I understand that there's barriers, like you said, in regards to seeking the union and all these other things and finding help for yourself. However, at the end of the day, you need to take accountability for yourself. No one else is going to do the work for you, especially when it comes, you only know the level of stress that you can manage. No one's going to do it for you. And if this is not a place or setting where you feel like you belong anymore, then that's something that you need to take upon yourself and really assess. And there's a front line for everywhere. You can find a new one. You can find a new place for you. Find a new
You can
purpose.
change this. Yeah. There's like my and a lot of us say this a lot. Always a way of fixing things. Always. You could fix anything and everything except, you could find a solution to everything except death. So while you're still alive and you're still healthy and you're still capable of doing things, make the necessary changes that you need to make for yourself. Of course, make them healthy, make healthy choices, things that are gonna help you and those around you.
Yeah, and
Because
another,
you're important, you know?
yeah, I mean, absolutely. I know even to a point, some of the signs, which I'm not gonna go too much in depth with it, but some of the signs where you know your mental health is starting to decline, at least for me, that I do a lot of avoidance, right? Like there was a lot of happy hours after work, and there was a lot of like, oh, I can't wait till I get time off so I can take a day off or like go on vacation, and that's another form of avoidance that a lot of people don't talk about. If you're
Mhm.
feeling like you're constantly having to take vacations from work, like we all need a vacation, granted, even when we love our work. But when you find that you
An
constantly and
excuse, yeah.
consistently, like you might want to reassess.
Yeah. And I think everyone should seek an outside help or guidance, you know? It's always good to make adjustments.
Mentors.
Always good, yeah, yeah. Good to make adjustment, good to make changes that are positive for yourself and for those around you in your work area, family, personal relationships, because then you burn out every bridge that you could rely on, even with yourself. Because if you don't have a good relationship with yourself and you don't have that honesty with yourself, you can't have that honesty with anyone else. You can't.
I definitely had some aha moments, like listening to you, and some of the things that, like the moments that you feel like you were getting to the point of being numb, or that you were really like exhausting yourself. And that brought me back to remembering why I did this platform, because it's just like that's the thing that keeps me going, and advocating for us is just like, no, this is not okay. Like someone needs to hear this.
Yeah,
Because
yeah.
no one should feel like that. Like no one
Hmm.
should feel like that. And yeah. And we buy
Yeah.
and yeah.
No, no one should feel that way, and you do such a great job in building this platform. You've done such a great job. Like I've always told you, I admire like you doing it, and like you're so organized, and you're very well
I try.
rounded, and so it's good. And it actually like all the little notes that you sent me, I'm like, wow. I'm like, good. I mean, I touched bases, and I was able to reflect, and I gave you examples of mostly everything. Um, but it's such a good platform that you have.
I can't do it without you guys. Like I can't, no, I can't do it alone. There's some things that I probably can tackle some conversations, but at the end of the day, it's not the same without you guys. It's so funny because I had written in my journal, you know, God, please like guide me to like be a little bit more focused on this podcast or whatever, and this and that. And then you texted me. And like it was so weird. I didn't say it to you at the moment because I was like, nah, she's not gonna believe me. It's gonna like freak her out a little bit. But
No,
I
hello. I've been
promise.
going through my own spiritual journey too. Like 2020, like listen, if you did not use 2020 to do more like self-work on yourself or like be more self-aware, and yes, the virus. I mean, if you go back to history, how many viruses and pandemic we've gone through, you know? And this is just one of the other ones. And you have to find what is it that they've made, like what was it different, that what is it, be the same person you were last year, or do you want to make changes that you want to make, you know? Like I continue to, like I've told you, like the spiritual journey, I've always wanted to, you know, go back to my spirituality. That's something I touch base with my life coach, and then she go and I was able to do it. And the whole entire pandemic, I've done that. And every time I hear um like I'll say like the word of God, I don't do it all the time, but I do save an hour on a Sunday, and I do it there, and I listen to it, and I'm like, wow, it's like damn, like I was like thinking about that. Like, you know, like when you become more in tune with yourself and you're not like so cluttered and so disorganized and like busy with trying to go outside and do things that your friends are doing, or like what social media is going on, you know, like,
Yeah.
you know, it's this year was basically time for yourself, time for your loved one, times for those that are around you, time to build yourself for a better version for yourself, because at the end of the day, like, you're gonna have you have to love you the way you are, you know, the way you look, what you believe in, what you like, what don't you like, and you have to be okay with that. You have to be perfectly fine with that, and those around you that love you and appreciate you are gonna be with okay with that too, you know. And I'm very happy that you know how I'm a social butterfly, but I had a couple of individuals that would constantly check on me. I built relationship on Instagram, like with people like we've never met, and like it was like, we're like, hey, how are you? Like, hey, how you doing? Hey, I like your post. Hey, I'm checking up on you. You know, like that was like what this year was about. You know, like, you know, like it was a year of, they shook you up, grounded you, and make you think about like what is it that you want to change in your life. If you had the opportunity, what would you do differently, you know, compared to what you were doing back then? And like who is it that, like, what is it that you're doing to love yourself more, you know?
Yeah.
So that's what I've been like currently working on, and building my self-confidence, because it's, you know, I'm not gonna lie to you, like a lot of things and people could trigger your confidence and without even knowing.
Girl, that's a whole another podcast.
Yeah.
That's a whole
Yeah,
nother
but
podcast.
definitely,
But I relate.
yeah, but that's definitely something that happened throughout this whole COVID thing.
Yeah.
You know?
What would be your last words
To the listeners, what I've been preaching on my Instagram, like self-love. Self-love, like it's something that we underestimate so much, you know? Just how we think we should be kind to others, we need to be kind with ourselves. We need to appreciate ourselves and appreciate every little goal that we accomplish, you know? We cannot be so hard on ourselves.
I agree.
Everything takes time. Nothing was built overnight, and everything is step by step.
Man, listen.
I
Well,
know. We want everything like this.
yeah,
I'm one of them, but
I'm one of them
this year,
too.
this year definitely I learned how to slow down.
Yeah, so funny. But you, I can't stop looking at you. You're like glowing.
Yeah.
No, seriously, like you really do. No, but you really do look. You really do look more.
I'm happier.
Like
I'm happier.
it's
Sincerely, yeah.
I can see it.
Sincerely more happy. I'm not gonna tell you I don't look like this every day. It's not like this that I look every day. Call me Wednesday, see how I look.
Man, call me tomorrow. I'm gonna be disheveled. I'm gonna be a fro. This hair is gonna be like.
Yeah, definitely. Like I told you, self-care is the minimal thing, you know, like sleeping on time, drinking water. Because of the whole pandemic, I'm not gonna lie to you, I was one of them that I did not drink. Like I drank, but not as much as I was drinking before. Like I cut down on drinking, and it's something that I don't miss. And I was drinking to avoid, you know, the stress of everything and avoid whatever I had to do, you know, as a way of coping. It's normalized. Eating healthy, Sleeping as much as possible, exercising is such a great way to like release stress, help you release the happy endorphins, make you feel better after you work out. And it's not only physical that I do it for. It's not that. It's actually it makes me feel awesome. Like it makes me feel great when I finish a workout. When I just do
Yeah.
yoga, when I go for a run, when I look at myself in the mirror and I'm doing weights and one of my classes, like it makes me feel good because it's my time. I'm not thinking about anything else or any other issue but myself, you know?
Man,
Um,
I miss that yoga place that you recommended to me, and I started being consistently going using ClassPass. What was it? It's
oh,
Soul Yoga, right? Is it Soul
yeah.
Yoga in Winwood?
Yeah, so
Uh, I
yoga.
s- I said that when I go back to visit, that I was gonna take time out to actually go there.
Yeah,
Yeah.
they're still there.
Oh my God.
And I'm not gonna lie, I like once I like feel like I spiritually connect with someone, I'm like, yes, I love you, even though I don't know. And I have one person, like one of my yogi instructors that I love, which her name is Mimilicious, and she has such a great spirit. Like let me tell you, like she is. Once you walk into that class, she is like cheering you on, giving you like self affirmations, and like you could keep doing it, and you know take your time, do it slowly, re-breathe, refocus. And it's like, like, and it's all like, it takes time. And then she says it takes time. Nothing is built overnight. Everything takes time. Don't be so hard on yourself. And it's true. And it's
Yeah.
like, the thing is like, culturally, and I guess, yeah, you could say culturally, right? Like, uh, I think you're in your 30s, right? Now or no?
I just
So you're
turned 30. I am in here, baby.
okay, so women that are in our 30s, because I am older than you, so you feel that pressure, like you feel like you have not accomplished what you think you need to accomplish, which is basically live on your own, have your life together by this time, at least be married, or like married and with a child, or like, you know, live your own, be career successful. But being millennials, like a lot of millennials, like we spoke earlier and we mentioned it, is we're living at home with roommates, and some are our roommates or our parents.
Mm. And
And
so it
it's
is.
yeah, like
And we're
I
grateful, and we're grateful for it at
well,
times. Like we,
let me tell you, I wasn't grateful, I'm not gonna lie. I was
oh, I wasn't either.
desperately, yeah, desperately finding an excuse, and then super frustrated with myself and with my situation. But it's like, you know what, my mom is elderly, and I was like, you know what, there's a reason for me to still be here with her. And beginning of the whole pandemic, she was bad. She Her anxiety level was bad. Maybe she was even depressed. I wouldn't be able to know because she wouldn't say anything, but most likely it was depressing for her. And her anxiety level was bad. And she wasn't eating, she wasn't sleeping, she was not doing her normal things that she was able to do. And I was like, wow, I was like, change the roles changed. Like
Mm.
I had to be there for her because she couldn't be there for herself or for anyone else. So I was like, you know what? God always, 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 I'm gonna cry, always has a reason for putting you in certain situations,
Yeah,
and sometimes we don't take the time to understand it until it's too late.
yeah,
And I think this whole year is for that. Be appreciative of what you have and what you're surrounded with and who you have around, because you don't know if you're gonna have them around next time. you know and you'll get there. You're gonna get there, and you're gonna get to be independent and what you want. You're gonna get it. Just be gentle with yourself, and don't be mad at yourself, and don't compare yourself with anybody else. People don't tell you everything they do, or like what they do to get to where they need to get to. They just show you the outcome, and that's it. But they don't tell you all the sacrifices they've made,
The process.
or the process. Yeah, the process. And some people have even lost their relationship with their parents and wish they had relationships with them. But I think you and we have great parents, and then individuals that have been there for us, and that's something that not everyone gets to have.
Yeah.
So
And
you're doing good.
Yeah, and we both know what it's like when it does, because it could be challenging, and those reasons why at times we don't feel so grateful as we wish we could be, because of the circumstances and the difficulties of the culture, and just like the generational traumas of just like, of having those parents that just don't want to talk about how they're really feeling and being transparent about that, and then they lash out at times, and it's just like inappropriate, and it's just like they don't really know how to, they haven't had the opportunity to
they're probably
work.
not gonna do it. Exactly.
And they haven't given themselves that space to work on themselves.
Yeah.
And so unfortunately at times, like as a minority, because I feel like minorities experience it more, where it's like a cultural thing not to seek assistance or go to seek mental health help and whatnot. And I'm like, you really could benefit from it. No, like, hear me out. And it's just like,
no, girl. Yeah, no. Yeah, when was it? I think she had like a whole meltdown yesterday, and I was like, maybe you should ask your doctor. You're like, you need like therapy. Like, don't lash at us. Like, it was me and my brother. I'm like, we've done our best. I'm like, maybe you're just mad at yourself. And then I learned yesterday, that's part of like that's another step of growing, because I cannot take her feelings personal. That's her, and she needs to figure it out on her own. If she wants, the help is there, and she has to figure it out. And not to spiritual guidance. I mean, pray.
That's all we can do. That's all we can do sometimes. No.
Pray and don't feel guilty about your choices. And that's it. And always be respectful. I'm not gonna tell you I'm a perfect example, because I do have a mouth and I don't stay quiet, especially with her. I feel like we treat each other like sisters instead of like a mother and daughter role. So I've always been respectful, and I feel that's another thing I did this year, like build that relationship and make her understand that, dude, I'm old. There has to be some type of boundary, respect. So that's another thing. Like, not only you have to have boundaries with people that you don't think are family, but you do need boundaries with those around you that are family. Absolutely. For your sake, because you're not everyone. Even though you're related, and even though she's your mother, you don't think alike. Everybody has their own way of thinking.
So I think we gave the people more than
what they needed. Maybe
more than what they needed. But you know what? Everything is valid, and all great points that I'm sure a lot of people at this time are experiencing, and probably are going through too.
Yeah, a lot of people are going through a lot. Some share, some don't share. And I like, one thing I do want, and I want to make it. I want to announce it, and I want to speak more about that. Like, find people to share things with. Speak up. Say how you're feeling to someone close to you or not close to you. Vent. Don't wait until it's too late. Don't wait until you blow up, or like you do something very drastic, hurt yourself or hurt others. The suicide rate is going up. Suicide rate is going up, and people are not, and we're currently in holiday season, you know, like it's not cold here in Florida, Miami, but it's cold in other places, and I think other places have maybe like a stricter curfew and a more restrictive type of way of living currently. So there's always a way of finding help and venting. Don't hurt yourself, you know. Find and seek that help you need, and just speak to someone, reach out to anyone that you can, and you know, ask just to be listened to, or journal, or there's a lot of stuff you could do, like you could seek and YouTube. There's a lot of things that could help you, like positive affirmation daily, spiritual guidance, you know, keep it positive, you know, even though you feel like
Yeah.
crap sometimes. Try to face those feelings. Don't ignore them. And it's okay to feel that way. And it's totally normal to feel that way, because we are not robots. We don't feel happy go lucky every single day. There's no way.
Yeah.
You know, we feel good. We acknowledge that we're okay, that, you know, that we are alive, and everything else is that we have around us. You just start like that. Like, what are you grateful every single day, you know? And if you need that help, look it up. Like here in Miami, there's the 211 number, which is the switchboard number. Um, there's also community mental health clinics. There's another one that is called Thriving Minds. So those are the mental health resources that could be low cost, or they work on a economics threshold.
On a scale, I know.
Yeah, on a scale.
My last words would be buying into the busy culture. Please don't buy into the busy culture of having to feel like you have to be productive all the time to feel like you are a member of society, to fit into society. Please know that it's okay to rest, and and
Very important.
whatever rest looks like to you. If it means Netflixing, I said
Yeah.
it. Like, if that's what you need in order to like be okay and zone out for a minute, like whatever it is, if you need to go work out, go work out. I'd rather you go work out than go hurt yourself. Like, go do
Yeah.
something than buy into this busy culture of having to be like doing something all the time
Oh
and
my
like
God.
not giving
Now that
yourself
you
a chance.
Yeah, now that you say that, I also found out YouTube has like all these free podcasts, you know? And I don't have them on top of my head right now, but like they're like all good positive affirmation podcasts. Also, I mean, I'm sure everybody knows about Gary V. You know about Gary V, right? He's
No,
like
tell me.
So like Gary V, I really don't know how. Okay, so like he started his whole thing. I think believe he started like doing like more like kindness and positive things and positive affirmation, and like how to take things at a step. Don't compare yourself. Like also gives you like a business insight to things, and he's a more of a business minded type of person, but he keeps it like 100, like real, like raw. um People pay I don't know how much money to go to his seminars, and it's like basically he tells you exactly what we're talking about in right now currently, you know, like, you know, you want to go ahead and binge watch Netflix, go ahead and do it. But like, if you want to go ahead and start your YouTube or your podcast, or if you want to go ahead and like travel the world, just do it. Like, don't care about it. So he's more of a positive outlook person. He also has his own show. He also puts episodes on YouTube. He does have like this, actually, like a number. He has his own like free number.
What? What? What is
Yes,
it?
girl. He has like a free number. Like yesterday, like he'll send you like random messages, right? Like his number, this number, like those. So his message yesterday is because when you love yourself, other people's action towards you tend to unfaze you. Also remember, if you don't love yourself, someone instilled that in you. You can
Oh,
carve it out. Love, Gary V. So like he does this like random, like things of affirmation seminars, and and he is someone that you could learn from. He works with Nipsey Hussle. He's worked with the baby. He has episode with like the most it rapper or hip hop artists, and I believe athletes. I'm not sure. And people that are into the business, real estate, and all these big real estate individuals too. If you have the time, he also has his podcast. Another thing is self-help books and YouTube. I don't know who did this, but you don't have to pay for the books if you Google it like if you search on YouTube, like The Alchemist, the Four Agreements. I believe. Oh my God, another girl I love, Mel Robbins. She's the 5 second rule guru. She's hilarious. She's good. And I'm trying to get into the 5 a.m. club.
okay.
That's a good one. And I believe there's a YouTube podcast type of thing, but the book is there for free.
Nice. I'm reading right now Emotional Alchemy and Self-Compassion. Those two books I'm reading right now. So yeah, I do a lot of self-help books. I did The Subtle Art. I like that one. The Subtle Art of Not Giving a Fuck.
Oh, I heard it's good.
It is.
There's another one that came out this year. Have you heard of it?
No, but I've been doing a lot of NPR too. I listen to, that's how you know you're in your 30s, man. When you start listening to NPR episodes, they did an episode on burnout, and I was like taking notes. I was like, oh my God, me and Tahis are going to talk about this. Let me take notes. It was such a coincidence, another coincidence.
Yeah, it was meant to be for you to have this topic on your podcast. It happens a lot, and I think we're getting close. We are in the holidays, so it's fall, then winter, and it's one of the most.
Highest.
I think they call it the blues. Have you heard of it?
Yeah,
I think it's called the blues.
We get seasonal depression. Yeah. And then, but I've heard of what you're talking about as well. I can't think of the name, but I know what you're referring to.
The depression blues. It's something blues. So it's like real, guys. Like, yes, you're gonna feel sad, depressed, lonely. But it's okay. You're not the only one, and you're not lonely. And like Alexa and I have said, self-help books, podcasts, spirituality, exercising, going for a walk, distracting yourself for 30 minutes, it helps. The most basic thing, journaling.
Yep.
If you really need to speak to someone, reach out to anyone that you feel comfortable with, or let's blur it out, vent. Don't keep those feelings or those thoughts inside if you can't handle it. It's totally normal.
I actually found, I'm so glad that you brought up the hotlines for Miami. I was looking up the one here in Massachusetts. I was like, let me do a responsibility. So I found it. And the one for here, the National Suicide Prevention Lifeline here is 1-800-273-8255.
Yes.
That's the one in Mass.
Yes. So that number definitely will connect you with anything, any resources around your area, and call it up. There's always individuals working there 24/7.
Yes. Well, thank you so much. I'm gonna probably at this point. I feel so bad if I keep it going. I'm like, oh my God, I need her to
No.
keep some energy for herself for tomorrow. You have so many things probably going on and so forth. So I want to
Well,
be
yes,
conscious of that.
and it's always a pleasure. I mean, I think that I do talk a lot though.
Well,
So you need to stop me. But I think we target everything that needed to be said and made aware of, and the most important thing we reflected on, and we did this to educate and inform those around us, and hopefully people don't shy away of their feelings and find the help they need.
yeah.